Other first Thursdays at the Marin County Law Library. We're glad you are all here. I'd like to once again note that we're starting our second year with your continued support, and more we're having organizations that I think really resonate with you. I'd like to take a moment to thank our law library staff, and I'd like to start with Lori Valla-Olson, who's our law librarian, who's with us tonight. And I'd like to take a moment to give a shout out to her staff members who are helping her prepare to reopen our library. We're lucky to have Robert, who's been with us a number of years, Stephen, who I think is our second oldest employee, and may we give a warm welcome to Michelle Ullman, who joins us as a brand new employee. Welcome, Michelle. If you're with us tonight, know how delighted we are and how much we look forward to joining us. I'd like to give a shout out to our board president, Christine Fowler, who has been incredibly supportive for this project, our vice president, Tracy Bennett. All of these folks, Lori, Christine, and Tracy, absolutely make the world go round. They are generous with time and spirit, and they're part of the reason that we continue to be successful as an organization. So as you get a chance, take the time to get to know these folks. They're very important to what we do, and we're very grateful for them. I'd like to give a shout out before we get started to the next Lawyers in the Library, which, by the way, celebrated its 3rd anniversary last year. And Florencia and Maylin, this is one part of our group that you may want to tell your clients about when they come through the health hubs. On our 2nd and 4th Thursdays, we offer a free consultation with our attorneys who are volunteers here in the community. And while it is not a long meeting, it's an opportunity to get a referral to where they may need to be or find out facts they may need to know. I'd like to welcome now tonight's special guests. We have Maylin Santana, who is the Director of Grants and Communications from the Marin Community Clinics. We are equally delighted to welcome Florencia Parada, who's our Community Outreach Manager, and our Health Hub Supervisor Extraordinaire, in my humble opinion. These are folks that come to us to let us know about the clinics tonight. I have to tease them. Looking at your website, you're about 49 years old to the day. It looks like somewhere in February of 1972. A group of volunteer physicians and nurses began seeing patients in church basements here in Marin County. I believe back then, if I've got this right, and Maylin, stop me if I don't, it was called something to the effect the Medical Contact Service of Marin. You offered free medical care via the Episcopal Church of Our Savior in Mill Valley and the Fairfax Community Church. And here you are today in 2021, seeing over 38,000 patients a year. I'm going to turn it over to the two of you now, and I want to thank you very much for bringing this information to our community at a time when I cannot imagine we need to know about you more.
Thank you so much, Denise. Thank you for the introduction. Can you all see my screen?
Mm-hmm. Yes.
Yeah. Oh, great. Okay. So my name is Maylin Santana, as Denise mentioned. It's a great pleasure to be speaking to you today. Thank you so much for the invitation. And I will be talking a little bit about the clinics, the services we offer, and then I'll turn to Florencia, who will be focusing on the health hubs and how the operations look like now. And if it's okay with you, I would like to go through the presentation and then we can save the questions to the end, if that's okay. And maybe people, if you have questions and you don't want to forget, maybe you can write them in the chat box and then we can, talk about them later, if that's okay with you. And so I have been working at the clinics for about 7 years now. I had the great pleasure to work very, very closely with Florencia for almost 7 years. And I have worked at several different departments. So I know a little bit about each of the departments we have. So this is our mission. Our mission is to promote health and wellness through excellent, compassionate care for all. This is actually, I'm glad to share that this is an updated mission. We completed a rebranding process at the end of 2020. We felt that it was time and it was really important for us to have a mission, a logo, and to have a brand that would really reflect the magnitude of services that we offer, because we do offer medical and dental care, but we offer so much more than that. And so we wanted to make sure that that was reflected in our brand. And in our mission, as you can see, we promote health, but we definitely promote wellness as well. And we are a healthcare center that's open to everyone in the community. So we do serve patients who have public insurance, who have no insurance, but we also serve patients who have private insurance. And so we serve everyone. We don't turn anyone away. So we will serve anyone who walks through our doors. And so I hope you like our new logo and our updated mission statement. All right, so as Denise mentioned, I'm going to go over a little bit of our history. So we were founded in '72 by volunteer physicians and nurses, so almost 50 years ago. And we were providing healthcare in local churches for the first 20 years, so church basements. So you can see that we've come a long, long way since we started. We opened our very first clinic, full-time clinic in '92 in Green Bay. And if you've been in Marin for a while, living in Marin or working in Marin, you probably remember that modular building that used to be right next to Marin Health. A lot of people thought that that clinic was actually part of the hospital, but that was the first Marin Community Clinics. Today is the parking garage that's there. And so that was our very first clinic. And that was a big, big change for us, because we went from providing episodic care to providing primary care. So that was a big change for our patients and a big change for, for our clinics. And in 2008, we had a very successful capital campaign. And that capital campaign really helped us expand our services and expand to other areas in the county that we felt, would be really important for us to be, so our patients could, access our services. So that's when we started opening our clinics in Larkspur, Novato, and in San Rafael. And these are our beautiful clinics. We have 2 clinics in San Rafael on Kerner Boulevard. They're very close to each other, walking distance. We have 2 clinics in Novato, very close to each other as well, right next to each other. Actually, they share the same parking lot. Our clinic in Larkspur, the 5 Bonaire Road Clinic. So we used to be in Green Bay, right next to the hospital, and then we moved, I want to say about 4 or 5 years ago, to that office in Larkspur. So that's where our Larkspur clinic is today. And also our dental clinic on 4th Street. This is a clinic that used to be managed, the clinic that the county used to run. We took over about 2 years ago along with other clinics. And we've been the ones in charge of this clinic since. So this is our dental clinic on 4th Street. And I'm happy to share that we are opening a new clinic in Green Bay. So this clinic is on 1260 South Eliseo Drive. And so very soon we'll be able to, see patients there, and also we'll have a pharmacy there. We really want to make sure that we expand services for our patients, in that area. And especially one of the main goals that we have for this clinic is to make sure that we better serve our aging population, in Marin County. So it's going to be a great place to be, because as you know, just like our Larkspur clinic, not all, but a lot of the doctor's offices are in that area. The hospital is in that area. So it's a very great location. All right, so now I want to talk a little bit about our growth so you can see how much we have grown. And I have some data here since 2007. So, and then through 2019, we're still analyzing the 2020 data, but I do have some numbers to share with you. But you can see how much we have grown. We used to serve 14,000 patients in 2007, and now we have over 38,500 patients. You can see the patient visits, how much we have, grown. And we didn't have any dental services when we started. Now we have 27 dental chairs. We went from having 15 exam rooms to 97 exam rooms, 2 sites to 7 sites, and our budget has really, increased as well. So to share some data from 2020 with you, of course, it was a very interesting year for all of us, right? And very challenging year for our clinics. We had to pretty much adapt to providing care in a very different way overnight. We have been providing telehealth services. And for some areas, I want to say it's been actually very successful. And I'll talk about that. But to give you an idea, in 2020, we provided over 72,000 telehealth visits. We had over 21,000 patients received care. So this is in general. For our respiratory care clinic, we had over 3,800 visits. So since April, when we started operating those respiratory clinics. COVID tests, we provided over 4,000 tests that were provided to not just MCC patients, but other community members as well. Behavioral health visits, we provided over 10,000 behavioral health visits. And this is one area where we have only been providing telehealth services since, the pandemic started. And in a way, it's been successful because our no-show rates have definitely decreased, and our patients don't have to deal with, a lot of barriers that they had before. They don't have to think about transportation, arranging sometimes, childcare. Just even getting to our clinics was, could be challenging for a lot of people. And so it's been definitely a silver lining of the pandemic for us. And we have heard from our behavioral health providers that it's been, very successful, and they really hope that we'll be able to continue to offer telehealth visits even post pandemic. And as far as our health hubs, and we'll definitely talk a lot about our health hubs today, we have been providing an average of 1,000 boxes of food weekly since the pandemic started. So it's definitely increased a lot since, pre-pandemic. So, and we'll talk more about the health hubs. All right, so Marin Community Clinics is a federally qualified healthcare center. So Marin Community Clinics is an FQHC. I don't know if a lot of people know what an FQHC is, but we are one of the FQHCs in Marin County, by far the largest one. And what FQHCs do, not only in Marin County, but all over the country, is to provide care to underserved populations. So as I mentioned earlier, we serve everyone. We don't turn anyone away. If people have insurance, if they don't have insurance, we will definitely treat them. We serve FQHCs such as Marin Community Clinics, serve 27 million Americans in over 1,300 locations. So you can see in the map that FQHCs are all over the country. And the majority are in California, not surprising. And then after California would be Texas. But you can see that they're pretty much all over, the country. And in Marin County, also the Reader Center is another FQHC. Coastal Health Alliance and Marin Health and Wellness Center is also an FQHC, but they're much, much smaller than MCC. And there are definitely a lot of requirements that come with being an FQHC, but definitely a lot of benefits as well. Okay, so these are some of our patients. I'll talk a little bit about our patients. We like to say that we have the cutest patients in the county. So as I mentioned earlier, over 38,500 patients. About 1/3 of our patients are children. So I think it's pretty safe to say that the majority of kids that have Medi-Cal in Marin County come to MCC for care. Many of the adults are self-employed, they're small business employees, day laborers. And as far as ethnicity, 66% are Latinos. So we definitely have a lot of Latino patients. A lot of people think we only serve Latino, but that's not true. 24% are Caucasian, 5% Asian Pacific Islander. We have a Vietnamese community in San Rafael. We've been seeing more and more Chinese participants at the health hubs in Novato. And there is a 3% African American and 2% other. To give you an idea of income, 96% earn 200 or less of the federal poverty level, and of those, 77% earn 100% or less of the federal poverty level. So 100% of the federal poverty level for a family of 4 is 24,600, and 200%, which is the majority of our patients, 96%, would be 49,200. Just to give you an idea that in Marin County, in the Bay Area, that's definitely not enough. And also something I want to note is that is a federal poverty level. So it's a chart that the FQHCs use, and it doesn't matter where you are in the country. You could be in Hawaii, it could be in California, it could be in New York. It's the same chart. And so you can have an idea that, especially like I said, in Marin County, in the Bay Area, that's definitely not enough to get by. Okay, now we're going to talk a little bit about the type of care we provide, which is care focused on, it's integrated care. So the patient is in the center, as you can see in the chart, in the center of the care provided. And the care teams, when they're working, they work very closely together, and they make sure that they take into consideration the patient's preferences, the patient's cultural beliefs, and all that. And they work together. I think we are very fortunate to be able to have and to offer this to our services, because in Marin County, if you think about it, very few places, and maybe MCC is the only place where you can offer primary care, behavioral health, dental care, and all these other services in one place, and have your dentist talk to your doctor, talk to your behavioral health provider, the registered dietitian. So we feel very lucky to be able to offer all this in one place to our patients. And so I'm going to talk more about each of the services that we provide. So we definitely have pediatrics in some clinics. We have adult and family medicine offered at all clinics. We have oral health services in Novato and San Rafael, but of course patients can from the other clinics to receive those services. We have a very robust behavioral health program now. We started very small. In the beginning, we had to refer patients to the county, to other agencies, and now we're able to offer a lot of behavioral health services in-house, which is wonderful. And again, our behavioral health providers can work very closely with our primary care providers. We offer reproductive health at all the clinics. We have optometry, which is a great partnership that we have with the School of Berkeley. The students come to the clinics with their professors, the doctors, and provide all the equipment and the services to our patients. And this is huge, because before we had this partnership, we had to refer patients outside to other places. We had to advocate on their behalf, ask for a discounted visit. And the majority of the time, patients wouldn't follow up on the referrals. So now it's offered in-house. We can make better referrals to ophthalmologists, for example, because we have optometry. So it's a really great partnership that we have with the School of Berkeley. We have a great nutrition program. So one person in each clinic, at least health educators, And they also are part of the care teams, work very closely with our other providers. And they also have walking groups, and this is all pre-pandemic. Everything is kind of on hold for now, but they work very closely with Marin County parks as well to make sure that our patients get to visit the local parks, get active. It's all about healthy eating and active living. And so our pediatricians get very involved in that program as well. We are planning on trying to get our older patients more involved in this program, and it's all led by the nutrition program. They also participate in our health hubs. I think it's still on hold for now, but it's a great program to have as well. Specialty care is also great. For years, we were referring our patients outside MCC for specialty care, and there were just so many barriers. So having to coordinate transportation. Sometimes they would get to the outside doctor's offices and translation wasn't provided. And just because they were going to a new place, it could be, intimidating sometimes. And so we realized that it would just make so much sense for us to be able to offer all those services in-house. And we are now able to offer, we have orthopedic clinics, we have urology, we have acupuncture, we have chiropractic, we have a long list of specialty care services being offered now, which is great. And so our patients are much, much more likely to follow up on their referral and to show up to their appointments because they know where to go and they, already know our clinic so well. We also have Care Navigation, which is a fairly new program. I want to say now, maybe 4 years, so not that new, which is a great program too. We have Care Navigators on staff who are able to support our patients with their social needs. So if someone, for example, comes to our clinic and realizes, and the doctor says, you need surgery, and the patient says, well, I'm homeless, I cannot have surgery now, I wouldn't have a place to go, then we are able to assist our patients and refer them to other agencies. We work very, very closely with our partners in the community. Our Care Navigators know about all these resources that are available for our patients, so we can help them with our social needs as well. In the past, we tried everything our providers would try, but we didn't have like people dedicated to this kind of service, and now we do. So it's great to be able to tell our patients, well, we can refer you, we can try to help you with this other needs as well. We also have outreach and enrollment. So we have a team of enrollment counselors who can assist not only patients, this is actually a free service that's open to everyone in the community, and they can enroll patients in Medi-Cal, they can enroll patients in Cover California, they're certified with Cover California. Also Path to Health, CMSP, which is actually the very first program for undocumented people. So they can assist, not just enroll, but answer questions and provide assistance throughout the whole process. And also CalFresh, which is the former food stamps program. So another great service that we're able to offer. So if someone shows up at our clinics, they don't have insurance, we connect them right away with one of the enrollment counselors so they can explore the options that are available to them. Our specialty clinics, so a lot of the clinics we have used to be, the county used to run them, as I mentioned earlier, like the dental clinic. So we have STI, we have TB, we have the HIV clinics, and that's all now being managed, being coordinated by MCC. We had been talking to our county for a while to integrate these clinics because it just made a lot of sense for us to provide these services to the patients because they were already coming to us for primary care. And so, and going to the county just for, for these specific services. So it made sense for us to be providing all the care that these patients need. So we've been coordinating these clinics for about maybe 2.5 years now. And we also have our confidential teen clinics. So we partner with Huckleberry in San Rafael and in Novato with the North Marin Community Services, used to be Novato Human Needs. And so we provide the medical care, and these other agencies provide all the case management that the teens need. So Great to be able to do that. And we also have our clinics at the local high schools. So we have clinics at Redwood, and these clinics are all on hold for now, but Redwood, Tamalpais, and Drake High Schools. So we run clinics at those, teen clinics at those schools as well. Also offered in-house lab services, diagnostic radiology, and we have pharmacies. So again, great to be able to offer that in-house because our patients are much more likely to pick up their medication, to follow up on their referrals, because the barriers, we eliminate so many of the barriers by doing that. We also have our COVID-19 clinics, and I'll talk more about them in a little bit. So we've been offering testing, not just to patients, but to everyone in the community. We've been working in collaboration with our county, and also our respiratory clinics that we opened back in April to help as well. And then, of course, our wonderful health hubs, and we'll talk a little bit about our health hubs. So a little bit about our COVID testing clinics and respiratory clinics. So we have been offering drop-in clinics, as I mentioned, open to everyone, both in Novato and in San Rafael. But and it's a drop-in clinic to make sure barriers are eliminated. But also, if our patients would like to schedule an appointment, they can do that. They can schedule an appointment to be seen. They can be seen by, at our respiratory clinics. And our respiratory clinics, we've been operating them since April. So we started with them very early when the pandemic started, and to make sure that we would provide this enhanced care for patients with any and all respiratory symptoms, and also to alleviate the burden on the hospitals. And we have been participating with Marin County to do a mass vaccination. We started about 3 weeks ago, and now, as you have probably heard, we are vaccinating anyone in the community who are 75 and older, and also caregivers to older adults. And so we are working very hard to make sure that we get as many people seen as possible, and trying to do special outreach, to our patients as well, because we really want to make sure that they have the information and they have the resources, they need, that they are informed that this is happening, and that we are able to assist them at this, during this moment as well. And in the picture here, the guy with the mask on is Dr. Mitesh Popat. He is our CEO, so he's super happy. This is the picture from when he had his first COVID vaccine shot. And getting the test is Dr. Jose Chibras, who is our Chief Medical Officer. All right, so now I'm going to talk just a little bit, just an intro, a brief intro about the health hubs. I'll let Florencia talk more about it. So, and I want to talk just a little bit about pre-pandemic, because before the pandemic, we had this great mini health fair. Not that it's not great now, it's great, but we were able to offer so many services that are, of course, now on hold, and hopefully we'll be able to go back to offering all these services again. So every week, every Wednesday in San Rafael, and every Thursday in Novato. And we receive the food from the San Francisco and Marin Food Bank and the Extra Food program. And so the food is definitely the main activity that attracts people. But like I said, this is a mini health fair. So we wanted to make sure that we would have other services such as nutrition and health education, because we feel that that's so important for us to help to do outreach to our community. We always had somebody from the nutrition department doing like samples, giving away samples, healthy recipes, and really trying to help people eat healthier. We always had our health screening, so we had always a medical provider outside providing diabetes and hypertension screenings, and it was such a great opportunity to connect people that didn't have a home clinic with our services, or to even just screen people, and if they had a different home clinic, to encourage them to follow up with their primary care physician if that was the case. And we used to have our booth with community resources, and we would invite our community partners to come and present about their services, because it's such a great place to do outreach to our community. So our partners would come and present and talk about the services. So as Denise mentioned, a great place to volunteer, to get to know the community better, the needs, of our community. And we definitely always need volunteers. And I know Florencia will talk about that. And one last thing I forgot, physical activity was another thing that we were able to offer that was great. We had Zumba for a while, we had seating yoga. We definitely wanted to make sure that we would offer that and encourage people to exercise as well. So now I'm going to turn to Florencia, who is going to talk about our health hubs during the pandemic and how the operations look like now.
Yes, thank you so much. And it's a pleasure to meet you all and talk a little bit more about our food assistance program, still an outdoor program that we have in San Rafael and Novato. And San Rafael is always on Wednesdays from 1 to 3:30 p.m. And in Novato is always on Thursdays from 1 p.m. to 3:30 p.m. But as Denise know, one of our excellent volunteers that we have in this meeting, we, before open to the services to our community, we had to set up our community health fair, because it's still a mini health fair, but in a different way. We're doing it always trying to follow our COVID guidelines. We definitely, every time we have our volunteers coming to our doors to support our community in need, we definitely need to first register them, asking this. We always screen them with the COVID questions that we follow through the San Francisco Marin Food Bank and also with the county. And one thing that it is important for you to know, this is an outdoor program that provides food assistance, but it's not only food assistance. We're still providing to the community different resources that we know are important and a priority, especially now more than ever for our community members. In this program, as Maylin mentioned, we are double the number of participants. Before, we have about 300, 350, depending on the season. If it's winter, it's always less. If it's summertime, fall, we always have a little more of participants coming, but now double the number. Right now, we are seeing weekly about 425 to 500 people every time they come. Today, for example, we did have more than 500 people. And that is just letting you all know and us that there is a need in this community. And that's the beauty of these programs, that we're present to support our community. We're building community by having this diverse group of people coming and help us every week from different places, different backgrounds, different ethnicities. Our volunteers are a diverse group of people who are also developing leadership skills, because we have students from high school, from the Novato High School, the school district in Novato. We do have also students from the medical career pathway from the Novato School District. We do have also college students. We have our senior community who's coming and helping us. And that's the beauty of having a diverse group of generations there, meeting each other, building relationships, connecting, engaging, learning from each other, because that's what we want, to build a healthier community that can be stronger, that can be resilient, that can also support each other and know that we're here present when it's needed. So one other thing that we wanted to also talk about are programs that will support we are working in collaboration with the county, because what we know is that a lot of our families cannot come to our health hubs. They cannot come even on our drive-through service or our walk-up lines, because they unfortunately are positive with COVID. So what we do with our county is that in collaboration, we know every week if, for example, today we have 44 people who needed food assistance. So the county come and with their trucks, and we provide them with 44 boxes that they will deliver to the people who cannot come to our food pantry, so then they can have food on their table. So this is something that we value so much, that collaboration and partnerships that we're building with Health and Human Services and with other nonprofits. For example, we do have building relationships, Marin Community Services, always. Berta Campos, you might know her pretty well, who also leads a group of promotores. So we always in communication with our partners in Novato, because we want to know what's happening in Novato and how we can assist our community, how we can support our community who comes from Novato at the health hubs on Thursdays. We do have before the pandemic, we knew that in our program, we have 17 different languages. Before, people thought that in our program, it's only for Latinx community, for the Latinx community. This program welcomes everyone, regardless where they come from, regardless their race, their ethnicity. And it's also, for us, we needed to know how many languages we have in this program. And we did, and Mei-Ling was part of this project where we were collecting data, asking our participants some of the questions that will give us better idea about who's coming to our doors and what is their needs. So then we definitely know that there is 17 different languages in our program, people coming from different countries, from different, as I mentioned, ethnicities. So it was important for us to share that with our volunteer community too, so then we can all raise awareness about the needs based on where we come from too, and how we can support each other, because that's the goal for us, is to achieve equity, to reduce the disparities in health, to reduce the disparities in education. That's why we're also involving our school districts, our students from high school, our high school students, our college students. We do have also a group of college students from Dominican University who are doing their projects at our health hubs. And all is about public health and equity and how we can support our families, how we can understand the social determinants of health and what that means. What they are learning in theory, they can put it in practice at our programs. So that's another beauty of this collaboration. What also, there is a picture that I wanted to just show, if it's possible, because I know Denise, you were asking for this, and at the same time, just to let our community know, we care a lot about our safety, the safety of our community. So we definitely reinforce COVID guidelines. We definitely reinforce in our community, when we come to our program, we need to have our 6 feet distance every hour, every 30 minutes. There is the volunteer coordinator, myself, and other volunteers letting everyone know we're still in COVID times. We have to be in our 6 feet distance. We need to use our mask. We have hand sanitizer. We always have the gloves. We have everything you need, so then we can definitely provide a safety environment for everyone, not just for our participants, but also for our community, because our volunteer community. This program is volunteer based. It's definitely without our volunteers, we couldn't do this. We have every week about 25 to 30 volunteers. And that's something that we are so grateful, because people are giving their time, 2, 3, or 5 hours weekly to come to our health hubs in Novato and not just share their skills, their leadership skills, because definitely you're developing leadership skills there, but you're learning different languages there too. We have one of our students today who told us, when we were doing the outreach, we do outreach activities too, still providing resources to our community when they come at the drive-through service or our walk-up lines. And our volunteer, our student, was just telling us, all these years, because he's in senior in high school, all these years he's been taking a Spanish class, but he never talked so much in Spanish like today. He taught in 3 years. What he did today, it was more than what he did in 3 years. And that's another opportunity we're providing with our volunteer community, that we can learn from each other, we can support each other, and we can also take some risk, challenge ourselves, because the way we want to build community is by talking to each other, by also learning who is your neighbor at this moment. We have different stations, different food stations. So that station next to the other station, that's your neighbor. And we might never saw each other before, but now you know each other. So that's also our time to meet, to also build that connection and then share what we're doing with other community partners when our community, so everyone knows that everyone is welcome at these programs. We also work in collaboration with the Marin Organizing Committee, and I believe Dr. Levitt from our Marin Community Clinics is also present. And with the Marin Organizing Committee, we do work in different needs in our society, social needs that are affecting our community members. And if it's about tenants' rights or housing situations that we're dealing right now in times of COVID, a lot of our families that we know, our participants that are coming are letting us know that unfortunately are getting or evicted or displaced from their place, so what we're trying is to advocate for our community members. We're trying to support, learn, educate ourselves about the different policies that could help our families, especially with the housing situation. If it's about health insurance, we do have also our activities at the health hubs, an opportunity while people are waiting in their cars for us to open our services. We have an opportunity to talk with them. So our students or our group of volunteers who are in our outreach team, what we're doing, like for example today, because every week is a different topic, this week was about health insurance. How many people have health insurance? How many people don't have health insurance? And what can we do in our clinics to help everyone to access health insurance? Because we do believe it's a right for everyone to access this type of service, this type of benefits. So we did have, we collect data. We ask our families if there is anything we could do to help them to explore their options with healthcare. So we also have in our clinics, as mentioned before, also we have enrollment counselors who can help our families to access health insurance if it's not with Medical, Medicare, Cover California. There is families who were coming and didn't have any insurance or didn't know how to access insurance. So today, our students were helping them and letting them know we have a department at our clinics that could support you. And we will be connecting and engaging our families who come to our doors at the health hubs and our outdoor program to the services that we're providing in our clinics. And so, yeah, that's about the health hubs. I just wanted to let you know that we're very lucky and blessed to have a community that comes every week, help others. We're very lucky to build equity, and we appreciate the opportunity you're giving us to support our community in need.
Thank you, Florencia. And I just have one last quote that is actually from our CEO, Dr. Popat, and it's actually talks a lot about what Florencia was just talking about, that we feel we are a family helping other families in the community. Every day we strive to do more and be better for the people we serve. And that completes our presentation today. Thank you so much again for the opportunity, and we would be happy to see if people have questions for us.
I know that we had a question earlier from Bill Hale. Bill, would you like to give your question now?
Yeah, I'd like to know some more about what the clinic's doing in the direction of developing geriatricians for people as they age. You mentioned that briefly. Could you tell us some more specificity where you're going with that, since we're all getting much older, especially Marin, I think, has the oldest population in the state. So that's of interest. And I have one comment when you get through.
Sure. And I think you did email me that question, and thank you so much, Bill. And so we don't have a geriatrician in staff per se. They're actually short in supply nationwide, but we have, our doctors are internal doctors, internal medicine, our family doctors take care of our older adults. And we have a lot of services that our older adults benefit, from. So for example, we have a complex care team that can help patients with complex medical needs. And a lot of these patients are actually older adults. And we also have, and it can help with like medication and a lot of other things. Our complex care team, our dental, program as well. Older adults can definitely benefit from, these services, behavioral health, nutrition. And so one of the main reasons why we open, as I mentioned earlier, our Green Bay Clinic is to better serve our aging population in Marin County. And so we're definitely keeping that in mind, and we'll definitely, it is our goal to be able to, hire a geriatrician and to hire doctors that can take care of our older adults. So we definitely have that in mind. And again, this is one of the main reasons why we open our Green Bay, clinic. Yeah, do you have any?
I have a follow-up comment I'd like to make on this. For everybody that's listening, we're all in the same boat. We're all getting older. Hopefully we get old enough to need geriatricians. We make it that far. One thing I advise you to do, whatever you do not ask your primary care physician when they're going to retire in your planning. I did that for mine. Next visit I saw her, she said, I hadn't thought about it, 2 months, like a death in the family. So be smart, think ahead, and don't ask your primary when they're going to retire, because you don't want to get that kind of an answer.
Does anyone else have any questions that they'd like to ask today?
One thing I wanted to add, so we also work very, very closely with Vivalon, that used to be Whistle Stop, also the Marin Center for Independent Living. And so we partner with these other agencies to make sure we can provide a full, care, or to be able to provide more resources, to our older patients as well.
Would anyone else like to ask any questions?
Hi, I have a question. I work at, I work for, oh my gosh, Homeward Bound of Marin, and we're at the Kerner site, which is right across the street from you guys.
Mm-hmm.
And I was just wondering, I've never seen your guys' fair. Where do you just have it on campus?
And are you talking about the health hubs?
The Wednesday fair that you're...
Yeah, that's the health hubs. It's the outdoor community food assistant programs on Wednesday. It's not at campus. It's at the 3110 Kerner Boulevard. That is where our dental clinics are too. And our services start from 1 o'clock to 3:30 or 4, depending on how much food we receive from San Francisco Marin Food Bank and extra food programs.
Thank you.
As someone who's participated in their health hubs, I can only encourage all of our listeners tonight to try it sometime. If it's not something you've done before, if you think it's not in your comfort level, you'll be surprised at the people you meet. You'll be surprised at what a great experience you have, and that you'll find yourself wanting to go back yet again.
I have a question. If I became aware at the law library of somebody who needed health care, and they said that they didn't, they couldn't afford health care, where would I send them? Like, is there a number they should call, or should they show up at a health hub, or how do they start?
Process.
Yeah.
So the best way would be for them to call our main line, which is, I can give it to you, it's 415-448-1500. So that would be the best place to start, because our call center representatives would schedule a time for them to talk to one of our enrollment counselors. And so to be pre-screened. And we're doing a lot on phone, over the phone, anyways. But even pre-pandemic, they would pre-screen, the patients over the phone. So that would be the best. And if they realize, they explore the options and they realize that the person would qualify for something, then they would let them know what, would be needed and all that, and could even enroll them over the phone.
Okay. And does a person have to meet those federal poverty guidelines to be served by Marin Community Clinics?
No.
No. Okay.
No. Mm-mm.
Okay. Thank you.
You're welcome.
Does anybody else have any questions tonight? I would like to thank Maylin and Florencia, and I am hopeful that this is the beginning of some collaboration that we might be able to do in the future. We would definitely like to extend an invitation and invite you to let your clients know about our Lawyers in the Library programs. And also, I'd like to suggest that some of these, the first Thursdays, may be of benefit. We had the opportunity in the last few months to have the Center for Domestic Peace. We've had Homeward Bound. We've had an extraordinary group. We had our recently retired director, Paul Ash, came and spoke to us about the food bank last year. At this moment, I'll tell you, one of your collaborators will be with us next month, and it's with great pleasure that I'm going to announce that Ann Gray will be with us, and she's the new CEO of Vivalon, or the organization formerly known as Whistle Stop. So Maylin, it was reassuring to hear about a group that did some rebranding last year. I'm sure Ann is looking forward to making Vivalon a little bit more user-friendly and in recognition. So it gives hope to us all. Organizations change and they continue to grow, and look what's happened with you.
Definitely.
We are delighted to have had you tonight. If there's anyone that would like to add any make any comments or any suggestions about what kind of groups they'd like to hear in the future, we'd love to hear from you. That's how we learn.
Anne is actually, I think, in the group tonight, right?
Lucky us.
Is that the same Anne Gray?
I am here. I just chatted in a message that I'm really looking forward to next month, and it was a really great presentation tonight. So thank you so much. It was really informative, and I love your new logo.
Oh, great. Thank you so much. And thank you for the opportunity.
We're delighted to have the kind of groups that we want here actually all coming at the same time. Lucky us. We are delighted to have the community clinics. We're delighted to have Vivalon. We were delighted to have Star Courts last month. We're very blessed in Marin County. It takes a reminder of getting us all together exactly how much we are, and to get the word out that there are people who are here to help those in need. And we thank you, Maylin. We thank you, Florencia. We are so glad you are part of our community.
Thank you so much.